Well, Mimi, first, better care, because right now many nursing homes are having to turn people away. So they'll be able to accept more seniors, which means less pressure on Washington hospitals, and something advocates I spoke to say is a good first start. As nursing homes face an upward battle post-pandemic.
Post-COVID is sort of a myth because we're still all in COVID in nursing homes.
A door to a little help is now open thanks to a $69.3 billion budget approved earlier this year by state lawmakers to fund critical state services over the next 2 years. $107 million of that going to nursing home providers.
When we look at where is that money going to go to, primarily it's going into wages.
The latest data from the State Department of Social and Health Services shows 62% of people living in a long-term care setting are covered by Medicaid, which means the majority of income for these facilities to pay staff depends heavily on the state.
Not being able to staff adequately certainly has the potential for some lesser quality of care.
Administrator Stacey Mazzeros points to vaccine requirements, competing salaries with hospitals, and needing to pay staffing agencies a cut for temp workers for the issue, which the Washington Healthcare Association says impacts more than just seniors.
The Washington state population of seniors and those who will need this care is growing tremendously. And our ask of the legislature is both to catch up and keep up with the actual cost of care.
The increase, which kicked in July 1st, will vary depending on the nursing home. But according to the Washington Healthcare Association, the average increase for skilled nursing facilities, for example, went from $20.18 to $21.59 per patient per day.
We are able to start looking at hiring our own staff again. And the new rate increases that are happening in July are really critical for us because it helps catch up part of the gap.
Now that gap is in the millions, according to Washington Healthcare Association. Nursing homes have been operating in a deficit for years, $122 million in 2021 alone. Again, this round of funding, $107 million. In the newsroom, Angela Kakade, I'll send it back to you.